You think a stress test is a simple check for blocked arteries, but it can also predict your risk of dying from cancer. It reveals deep secrets about your body's overall resilience. It's about hidden data, like how fast your heart recovers. We'll decode these signals and the questions you must ask your doctor. So let's start with the basics. What are we looking for on that treadmill? The main goal is finding big blockages, 70% or more, that limit blood flow and cause angina when you exert yourself. The EKG is also screening for other critical issues, abnormal heart rhythms that appear under stress, or signs of poor valve function. But what if the test signals a problem, yet an angiogram shows your main arteries are clear? Is it a false positive? For years, that was the thought. Now we know it often indicates coronary microvascular dysfunction, or CMD, a disease of the tiny vessels. A stress test detects CMD by measuring function, validating the symptoms of many patients who were previously told it's all in your head. This shows a critical shift. Your actual performance on the test is perhaps the most meaningful data, showing how well your systems work together. We measure this in METs, or metabolic equivalence. Higher METs on the test mean a profoundly lower risk of death from any cause. Next is heart rate recovery. How fast your pulse drops after exercise. A slow drop points to a system that can't calm down efficiently. Then there's the rate pressure product, heart rate times blood pressure. This estimates the heart's oxygen demand. A healthy heart can hit a high number. With all these different metrics, how do doctors combine this data into a single, useful prediction for your future? They use formulas like the Duke treadmill score. It integrates your exercise time, EKG changes, and symptoms to calculate your long-term risk. Remember our patient with a positive test but clear arteries? Now their doctor can diagnose CMD and begin targeted treatment, validating their experience. Consider someone with a known 50% blockage. For them, the test is about performance. High METs can show their risk is low, despite the known disease. Let's be clear on the power of this. Your exercise capacity is a stronger predictor of survival than many clinical factors, sometimes even the disease itself. Imagine two people with the same blockage. One struggles at 5 METs, the other hits 10. The second person has a dramatically lower risk of dying. This sounds definitive, but the tests are not perfect. When can they be misleading? A test can be falsely negative with balanced ischemia, where all 3 main arteries are equally blocked. With no differences to spot, it can look normal. And true false positives happen, particularly in younger, low-risk people. Anemia or even elite athletic conditioning can cause EKG changes that mimic disease. Even our best performance metrics have nuance. A score of 8 METs on one treadmill protocol does not equal an 8 on another. The test type matters. So to increase certainty, doctors add imaging. A stress echo or nuclear scan lets them literally see blood flow and watch the heart wall move under stress. Okay, we've covered blockages, performance, and limitations. Now let's connect all the pieces. Let's return to the cancer claim. Poor performance on the test, low METs or poor recovery reflects a body less resilient to ALL major diseases, including cancer. This reframes the entire test. Normal doesn't mean you are safe from a heart attack. Abnormal does not automatically mean you need a stent. The test value continues after diagnosis. It is used to monitor if treatments are working and to prescribe safe exercise levels for improving your health. So, after all of this, what does it mean for you as the patient? It means a cardiac stress test is a physical exam for your whole body's response to stress, giving a powerful look into your future health. And of all the data gathered, your exercise capacity is arguably the most meaningful, vital sign you can obtain from it. So ask your doctor, what was my capacity in METs? Was my heart rate recovery normal? What does my performance tell me about my long-term risk? Understanding what this test measures transforms you from a passive patient into an informed partner in managing your health for the long term.